In this episode, we're talking psychotherapy versus coaching. I think a lot of our listeners probably don't realize that we could have offered a service that was under the roof of psychotherapy or therapy. You have the qualifications. Dr. Glen is not only a PhD, you have 20 years of clinical experience. On top of that, you are the department chair actually for Whittier College's
social work department.
The question remains though, why did we go for kind of the title of coaching versus therapy?
Well, there's huge distinctions. There is some overlap, but we made a very informed decision talking it out to choose coaching over psychotherapy.
Yeah. So in this episode, we're going to talk about that, but also on your side, like which of these two might be right for you, because there is a major difference. So let's get straight into this one. I'm going to go ahead and just quickly introduce ourselves. If you guys are new here, welcome to 12-Week Relationships. My name is Pye. I'm an educator.
I'm Dr. Glen.
Dr. Glen is our PhD. He's our legitimacy. And we're going to get straight into this though, and we'll save all the other stuff for later. So number one, why don't we just clearly define kind of coaching versus psychotherapy from just a overarching standpoint?
Yeah. So if you break down the distinction, so therapy is basically on the lower end of the spectrum. So you basically have a diagnosis, whether it's like depression or schizophrenia or bipolar disorder. And the goal of treatment is to move you to the middle phase where you're functioning normally and you're adjusting to everyday life.
Well, and I want to define that spectrum because people might not realize what we're really talking about. If we were looking at it like a spectrum of mental health, right? The lower end of the spectrum that you're talking about is kind of being in a place where you're unable to function. You're on the lower end where mental health is affecting your everyday ability,
life,
right?
Yeah.
So on the higher end, so when we discuss this spectrum, on the higher side, you're kind of working to being just the better version of you, right? Success in your career, personal success, relationship success, that kind of stuff.
Yeah. So on the higher end of the spectrum, coaching is focusing on quality of life. It's about skill enhancement. It's about finding what's meaningful to you and living a better life. Whereas therapy is on the lower end where it's about symptom reduction. Like you're depressed or you have such severe anxiety that you can't function. So we want to get you to a space where you're functioning like everyone else. We're moving you to that middle phase.
Yeah.
Right. Whereas coaching is on the higher end where it's about building a better quality life for yourself. That's a huge distinction.
It's massive. Coaching is almost like, let's pick you up from the middle and kind of take you toward the higher end, as opposed to psychotherapy. Like if you go to a psychotherapist and you're looking for increased job satisfaction, like getting to a place of higher fulfillment, those aren't really things that are necessarily covered by like medicine and traditional therapy practices, right?
Yeah, it'll be talked about, but it would be the main focus is why are you there? So if you're depressed, they're going to focus on reducing your depression symptoms and then secondarily focusing on your career, right? Where on the flip side, coaching would be like, okay, let's look at your career. It's making you unhappy. So what can we do to advance your life and to improve your quality of life?
Yeah.
So that's kind of the difference in that.
I almost feel like that distinction already provides a really good grounds for which one of these might be more appropriate for you. Like if you're grappling with, let's give an example. Let's say that you're dealing with sexual abuse or deep-seated trauma that's affecting your everyday life just to be able to function as a human being. Then we're really talking like psychotherapy, like to get you to a place where.
Absolutely. And if that person went to a coach, that could cause a lot of damage, right?
Correct.
Because if you're like in trauma and you're having all of these trauma symptoms and you're like, let's find the purpose in your life. I got to find purpose in my life too. I can't even deal with my own symptoms.
Yeah.
That would be counterproductive in that scenario. But also on the flip side, let's say you're seeking purpose in your life and then the therapist is diagnosing you with depression and let's relieve your symptoms.
Yeah.
I don't want to talk about my symptoms. My symptoms are the product of I'm not living my purpose. I want to get purpose in my life. That could be counterproductive. So we get a lot of clients that come into the coaching services saying, I saw a therapist and it was so ineffective and we just talk in circles and I can't get the life that I want because the services do not match.
Well, and taking that same person, it's kind of like, let's say that same person, you've gone through something that was extremely traumatic. It could be sexual abuse, verbal abuse, physical abuse, whatever it might be. You've been through something traumatic, but for the most part, you've come through, you're on the other side, you're working towards meaning. if at that point you go back to a psychotherapist, they're going to focus back on the past. They're going to take you back and let's deal with this. Let's process this. And you might have already been mostly worked through that. It's more so like, well, no, I want to move forward now.
Exactly. And then the therapist in that scenario would be like, but you're maintaining. You're doing all right. So let's make sure you maintain. But that person might be like, I'm already maintaining. I want a better quality life. How can you help me? And this is where that conflict and frustration takes place.
Yeah. It's interesting because depending on where you're at on this, so-called spectrum that we've defined, either one can cause damage. Like if you go to, traditional therapy and you're looking for, you're basically just, on that side, I honestly don't think as much damage would be created, but you're essentially going to be probably wasting your time, maybe taking drugs that you don't need to be, all of that kind of stuff. On the flip side, that's where I think a lot of damage can be done by coaches who don't know how to properly address deeply rooted issues.
No, I agree. Like an example of that is when I was working with other coaches, there was one person and this person was like constantly like, I'm constantly anxious and I'm so overwhelmed and I can't control myself and I'm constantly crying. And then the coach was like, oh, it's because of your inner child is sad. Your inner child is anxious. And if you can heal your inner child, your anxiety would go away. But that was not the case, right? So then we redid the assessment and then it's like, this person has a history of bipolar disorder.
Yeah.
And then does your moods fluctuate? And then they're like, she was like, yes. And I go, so when you're on this uptake, you have anxiety? And she's like, yes. But when you're on the downtake, do you have anxiety? She's all, no. So then 10 years of inner child work, she went to a psychiatrist. 1 month later, she was fine. She never came back. So that is, it's really like they're both needed, but it's really important that, as the consumer, you really figure out what it is that you want and what it is that you need so you can get the help that you need.
It's also why we make a very big distinction. So if anyone is looking at like the TWR coaching program, you'll notice that it says very clearly that this is not for, people that are grappling with emotional abuse in a very deep sense, right? Physical abuse, sexual abuse, major drug addictions. We kind of take those out because we sort of have a baseline expectation that you're functioning. You're okay and you're at that middle to higher end of the spectrum. And that's where we're going to start with.
Yeah. Or even if you were on the lower end, you worked yourself to that middle phase. And now you're like, I want to have a better quality of life now.
Correct.
And once you're in that space, then this is a program that's for you.
Correct. So that's probably the biggest distinction between these two. And because of this, there's other things that are important to understand. One, let's talk about, I guess the next piece of this would be like licensing as well as insurance, right? Because on the therapy, psychotherapy is, well, not only is it governed by a licensing board, but then it is covered by insurance, whereas on the coaching side, it's not.
Yeah, there is no governing board when it comes to coaching, right? So, on the insurance side, it's basically off of the DSM manual, which is a diagnostic and statistical manual of mental health disorders. And it's based off of stats. It's based off of averages. Like what is, in any society, what is the normal behavior? And then what are the outlying behaviors that take place that are not considered normal? So the whole goal of any type of insurance covered treatment is to move you to the middle. Like that is the ultimate goal, like just to get you functioning in a normal society in a normal way. It's about maintenance. And this is the huge distinction. It's about self-esteem over purpose. So like, for example, like if I came to you and you're the psychiatrist and I'm like, I want to pursue this dream of mine, but then they're all like, but you'd probably tell me, well, is it going to cause you distress? And I'm like, yeah, it scares the hell out of me. Then you're gonna be like, don't do it.
Yeah. It takes you away from the middle. It takes you away from
the middle. So like exercise more and just make more friends and here's some more medication, like increase your medication. Let's maintain in the middle. And then if that's not what I'm looking for, then I should probably not seek that service and go see a coach.
Yeah. But the other distinction too on the insurance side, right, is that given that it is covered by insurance, well, every insurance company is out to generate a profit. And what they are going to do is they're going to say, well, what is the pathology and what is the proven method of improvement to get to something better? This is what we're going to cover. If there's a pathology and there's a proven method of medicating or of helping, we will cover it. Otherwise, no.
You bring up a really good point. So yeah, on the insurance side, the whole goal is like to treat the lower end of the spectrum. So if you really are depressed or you really have a disorder like PTSD or schizophrenia, then this is for you because you need to reduce your symptoms, right? However, like let's say you just have everyday life problems. To get treatment, they still have to diagnose you. So they're going to still label you as depressed.
Yeah. They have
anxiety
to put
disorder,
you into something.
Even though like it's maybe moderate or whatever,
Yeah.
but just to get the insurance money and claims, they have to give you a diagnosis anyway,
Correct.
right? And then so in that lens, the treatment is still the same, even though you probably need something different.
Correct. And that's what's kind of crazy about it is you want to go to your psychotherapist to say like, you know, I'm having this issue at my job, or I'm having this issue in my relationship, or whatever it might be. But in order to actually make sure that it's covered by insurance, to make sure that everyone's paid out, well, let's test you and see if you have anxiety. Let's see if you have ADHD. Let's see if we need to do this. And then the treatment is, again, according to the DSM and according to every other practice of this is evidence-based and this is what works. You might not need drugs. You might need something more kind of holistic and more like a kind of a different approach to life. But what you're going to get is basically what everybody gets. It's whatever it takes to get you to that middle spectrum.
And then the ultimate goal is maintenance.
Correct.
Oh, you're in this middle, you're functioning like everyone else. Goal accomplished. Just stay in that space. And that's where a lot of people get frustrated. Or like people that come for couples counseling, they'll complain about like, we're trying to build our life, but we just go for years and years because that is the model through the insurance company. Keep coming back and maintain and just stay in this space. And as long as you guys are in this space, you guys are good.
Yeah, you had a very personal experience with that, right? Where towards the end, your psychiatrist told you like you shouldn't go and like you need to go back to the job. You need to go. Give us a little rundown of that.
Yeah, so this is when I was getting death threats at my job. You know, death threats. I had a rat at my front door with the bow and arrow in it.
Yeah, in case anyone ever missed that, it's back in I think episode 9. We went into Dr. Glen's backstory of everything, but essentially you're at this social work job that is destroying your life.
Yeah, and I was bound to get a promotion, and once the promotion was happening, then my boss was like, she had like her minions, and I was getting like 500 death threat letters. You're gonna die. I'm gonna kill you. My windows were slashed. My tires were slashed. A dead rat was in my home, so I filed a police report. I filed a lawsuit. It was really traumatic. And then the loss of friends, because people it started spreading, and then people started changing towards me. So it was just this whole transition. And then basically, I went to a psychiatrist, and then I was getting treatment. They're like, "Oh, dude, you basically have the brain of someone that has PTSD that's been in war." And then I was like, "Cool, man, thanks." And then they got to the treatment plan, and then this is where I was just like, the psychiatrist is like, "Look, you understand the treatment model, right? So you're gonna have to quit your job. You're gonna have to get something less stressful. You're gonna have to, the teaching is good. Why don't you stay in the teaching, and then just live a minimal life so that you don't have too much stress, and then just kind of focus on that." And that was the medical model of treatment for me. And I was like, no. I was like, I agree with everything they're saying, but I can't do that because I was not in that space of symptom management and just trying to stay in the middle. I was like, this was a big situation in my life that was telling me that I have to live a life of purpose and I have to follow what it is that I want to do.
Well, that, to be honest, would have been the great place to hand you off to a qualified coach at that point.
A coach.
To say, look, this environment is super toxic. You need to be done with that, and you need to actually figure out what it is that you're going to do. And this is going to be a difficult process, but you're going to handle it, and I'm going to help you with the tools and give you the ability. And
this is, I told the psychiatrist this, like I didn't tell him the episode, but he was like, you got to protect your self-esteem. And I was like, fuck my self-esteem, man. You can kiss my self-esteem's ass, right? I'm going to pursue purpose. And if my self-esteem is hurting, I don't care. I'm going to work through it, and I'm going to pursue my purpose over protecting this somewhat esteem that I have to maintain what I have. I go, that's ridiculous.
Yeah. It's fascinating because it kind of like, it encompasses exactly where, it's weird because both sides of this, if you're a coach, you kind of get stuck in the side of thinking that, well, coaching is the only right way, right? Coaching is the most effective and the right way, but that's not true. And if you're a psychotherapist or a counselor, whatever it might be, you're kind of stuck in the way of like, this is the right approach to getting somebody healthy and this is the only way, and this is what needs to be followed. They both get locked into this instead of realizing that really they're they're playing two sides of the same coin. That once one side has been satisfied, they need to push the person to the other side.
It's continuation of services, transferring them over.
But that's not what happens.
That's not what happens. And then they just try to keep them. And like, you just stay in what this discipline is, even though that you're ready to move on, you just stay in this middle. And that shouldn't be happening.
Yeah. So another clear distinction then from that standpoint is that while therapy is covered by insurance, coaching is not, right? So coaching is out of pocket.
Yeah, you got to pay out of pocket because it's not covered. And we're not trying to diagnose. There is some form of symptom reduction, but it's more about life enhancement skills, personal development. So like, for example, if you're going to see a therapist, they're going to be like, we need to reduce your symptoms and make sure that you do things in your life that are comfortable for you so your symptoms reduce.
Yeah.
On the coaching side, we take a different approach. We're like, okay, if you're triggered, that's good. So you're going to have to work through that trigger, pursue your purpose, and through that purpose and making those choices of seeking your purpose and working through your pain, you're going to mentally and emotionally expand and experience more of yourself.
Yeah.
That is a huge distinction.
It's a huge distinction. And sometimes, you might wonder, like, why is insurance not covering coaching? And the most easy thing to jump to, like the most easy conclusion is, well, it must not be effective. And that's not true at all. An effective coach is highly effective at getting you to just, improving every aspect of your life, right? But the issue that we're talking about is going back to, again, what is insurance companies there to do? They're there to look at evidence-based kind of, what's the pathology? What is the solution? And where are the studies that prove that? And if you can prove it all, then we'll cover it under insurance. But if you can't, then we're not going to cover it. And this is why, insurance have a tendency to not really help with some of the most effective types of treatment across the board, because in many cases, it's difficult, if not impossible, to prove the linkage of like the kind of problem to the solution to the outcome. Because what are we going to do? Like in the standpoint of coaches, let's say that you genuinely help people to create better relationships, our goal, right? What is the statistical measure of that? Where do we start assessing somebody? How do we evaluate what the problem is? Then once they have the solution, they've made improvements, how do we gather empirical data on like, okay, well, out of 100 people, they now have 3 times more healthy relations. Like, what does that even mean? So it's virtually impossible to meet the criteria to be covered by insurance.
Once again, and you bring up another good point, because through the insurance companies, if you and I went for couples therapy, right? Let's say we're a couple, we each would have our own diagnosis, even though let's say we're technically not depressed.
Yeah.
But to get the insurance treatment, you're depressed, I'm depressed, even though we have couples issues. And then the whole criteria or measurement would be, well, Pye went from an 8, he said he was 8 because of their relationship. So I went to a 6 this week. Glen went from like a 10, he's down to a 9. So there is improvement in the relationship. That's not even addressing the relationship, right? No. It's just focusing on like depression or anxiety. It's not even addressing the core issue of the relationship that's taking place.
It's unfortunate. And the thing is that I do believe that eventually there's another arena that is very similar, not in terms of like treatment wise, but I had a knee injection for, it's called PRP, platelet-rich plasma injection, right? And it's basically for any athlete that, has old and kind of wants to have some recovery in the knees. Well, there's data on both sides that are kind of like proving that it's effective. Some people are like, oh, I don't know how effective it is, but either way, it's not covered by insurance yet. And the reason is because it costs a ton of money to go and to put this like research together, right? To go and actually gather the data, to go and prove that this is effective. And the question is, who's going to do it? Because the doctors that are actually doing the procedure, they don't have the time to go and do it, nor do they have the resources to go and do it. Insurance companies don't really have the motivation to go and do it because it's a money-driven practice. So why would we need to prove that something's effective if we're better off not covering it, right? So the only time there's going to be major improvements in terms of like insurance coverage in this area is if the insurance company at some point does a study of their own where they prove that getting PRP is going to reduce long-term costs of coverage. Like if they demonstrate themselves that, hey, patients that have had PRP overall cost less to maintain and require less surgeries, so we make more money. Mm-hmm. Therefore, now we will cover PRP. that's when it's going to be done. And in the same way, I do believe that coaching will one day fall under that. Okay, well, we now see that, patients that get coaching and that have this, they have much less need for mental health and other issues and anxiety and depression medication. Their cost of insuring goes down. The cost of this coverage goes down, and therefore we're making more money, so we'll cover it.
Yeah, you're right. It has to be profit driven.
It has to be.
Yeah, because insurance right now, it's profit driven based off of maintenance, right? Because the medications that you take, you got to keep taking it for a lifetime, right? Or for a long period of time. Therapy models, you got to be taking it for a long period of time. So it's not about curing, it's about maintenance. So you're right. If it gets to the place where it's profitable enough to have cures and to have big breakthroughs, then you're right. Then it'll probably change.
Yeah. And the funny thing is that companies have already seen the purpose and the effect of it, where companies are actually including this as a part of their health and coverage. So like my partner, Yen's company, for example, they actually include a life coach with your health insurance, which is insane. Like I've never seen that before.
Yeah, that's so cool. And then other companies too, like I forgot one of my friends, but she works for one of those big gaming companies, and they offer the same service, right? And even like Kaiser, they have the preventative wellness services now, because it's more cost effective to like, make sure that you take care of yourself and improve your quality of life so that you don't actually need to seek those services.
Yeah. Okay. So the big thing that we've kind of covered is like, again, we have that spectrum of function. Maybe we can give some ideas of how coaching versus psychotherapy might approach that spectrum, especially when you're in the middle, right? The lower end of the spectrum was, I have a difficult time functioning from day to day. And the higher end of the spectrum is, I'm doing good, but I'd like to do better. I'd like to self-actualize. I'd like to become the best version of myself.
Yeah, exactly. So if we have a common denominator, let's say that you feel depressed, right? And then like you just said, if I'm so depressed that it's affecting my daily functioning, I can barely do my job, I'm not eating a lot, I'm not socializing, I'm isolating away from my friends. At that point, the best approach for me would be therapy, because I need to get back on my feet. I need to reduce my symptoms, and I need to maintain and start building the life that I already have, right? So in that level of depression, therapy would be the best approach. However, if I'm feeling depressed and it's because I could function fine, but man, I'm so miserable with my life and I want to do more with my life, and I know that's the reason that I'm depressed, well, that becomes a purpose of life issue. Coaching would be your best option at that point. Yeah.
So on the one side, if you're to the point where it's like you can't function, the coach is probably going to be giving you things that are really not relevant. You need some sort of like treatment, maybe even drugs. And the coach is like, no, all you got to do is just exercise more.
Yeah. I mean, so this is where on the coaching side, they have to be responsible too and be like, yeah, if it's about symptom reduction or there's chronic illness there, you need to refer them back.
Yeah.
Right? Like they're not ready for this, life purpose issues. They need to go back and just focus on reducing symptoms and just rebuilding their life. So it has to go both ways. Yeah.
All right. So let's summarize then. For the person that's asking, psychotherapy or coaching, which one is right for me? What would you say?
So psychotherapy is about protecting your self-worth. Or if you don't have self-worth, it's developing it based on what society considers to be a healthy person.
Yeah, basically getting you to a place where you're functioning, right? If you, anxiety, depression, all these different things are just preventing you from living a normal life, psychotherapy would be the right step.
Yeah, so it'd be getting you to live a normal life, and then within that pocket of the life that you're living, trying to excel and maintain in that space, right? And if that's what your goal is, then, psychotherapy would be a good choice. However, if you're like, you know what, I'm seeking purpose in my life, I want to have a better quality of life, and you're willing to forego your self-esteem and saying, I know that as I stretch myself, I'm going to feel insecure. I may get down on myself, but I'm willing to pursue this anyway, work through my pains and figure out what I want to do with my life, then coaching would be your best option at that point.
Yeah. It's kind of like saying, I'm already in that space of I'm living a good and normal life. I have my issues and whatnot, but I'm willing to I want to push. I want to push and become the best version of myself.
I'm not going to protect my esteem at this point. I'm willing to forego that and pursue whatever I need to do to get where I need to get so that I can live the life that I want to live. That is a huge distinction.
And ultimately that's very if you think about it, it's kind of strange because at a certain point, like, yes, a baseline level of self-worth is critical, right? But ultimately, you develop that sense of self-worth, you develop that confidence through those accomplishments that are very difficult things. Like, you can't get to that place unless you were to essentially forego and say, you know, my self-worth and that's not the most important thing. The most important thing is this. But through that, you develop a far higher sense of worth and confidence in yourself.
Agree. Like, using a basketball analogy, like they talk about, there's 2 Hall of Fame coaches. So Larry Brown, he's famous for taking teams that really suck and getting them to the playoffs. Like, he's really good at that. Like, he's a Hall of Fame coach for getting bad teams into the playoffs. So they're above average and they're getting there, right? Yeah. Phil Jackson, on the other hand, he never takes those teams. He knows how to take a really good team, and get them to a playoff team and get them to the championship, right? Yeah. And that's a distinction between the 2 coaches, right? And it's just, you know, where you're at. Like, you know, in that analogy, where the team is at, you'd probably hire Larry Brown if you're trying to get the team into the playoffs. But once they're in the playoffs, you want Phil Jackson because he's going to take you to the promised land, right? Yeah. And therapy and coaching is the same thing. Therapy is going to get you to the playoffs, right? But then if you want to excel and get the championship, probably coaching is your best bet.
I love that. The 2 almost go hand in hand if we can actually, like, you know, come to realize it and wrap our heads around it. Really what you need is both of these coaches working in tandem to get them to a certain point, and then for one to pick up and continue the
other race. And then you know, if you're the owner and then the team starts, they suck again. Okay, let's go back to Larry Brown. Let's build them. Okay, let's go to Phil Jackson now. We're championship ready.
Absolutely. Yeah. And that's the thing too that we discover in the coaching process is oftentimes you will uncover certain things. Like, we will uncover some things and say, you know, this is best to go and find a psychotherapist to work one-on-one with, or to work directly with you one-on-one with. But outside of that, like, you know, setting of let's push forward, this is more like, let's take a step back at this point and address this piece.
And we've done that with some clients already. Totally. Like, you know, we've been like, look, you know, right now you're not ready for this. You need to go back and just focus on reducing symptoms and kind of just stabilizing your life. And we've done that. We take that very seriously. We're not here just to like just take money. We're here to like make sure that you get the best services and the services that you need.
Yeah. Well, awesome. I had a blast having this conversation. Hopefully it was insightful to everybody. If you guys would like to, well, look, the newsletter is an awesome source of weekly tips and insights. We make it highly valuable. They're custom handwritten messages from us, usually from me.
That is true. Props to you, man. Props to you.
You actually just got back from Japan, so welcome back, my friend.
Yeah, thanks, man. I appreciate that.
Props to you because you're usually in session. So I'm the one that's writing these by hand. They're not summary emails. They're awesome weekly tips, insights, all that stuff. You can join it from the link in the video if you're watching on YouTube, or you can hop onto our bio on Instagram, TikTok, and find it on 12weekrelationships.com / I believe, join the newsletter. In the meantime, we actually are, this week is going to be, we're halfway through our first online group cohort, which has been incredible. They're having a blast. And so, yeah, we're 6 weeks into that.
It's been an amazing experience, and watching their growth, and then, you know, just incorporating the knowledge and all the terminologies. Yeah. It's a trip to watch. It's been very, very cool.
It's really fun. And on a side note, so in the newsletter, we do let you guys know of upcoming cohorts and all that kind of stuff. The other thing too is it's completely free, and it helps us out tremendously if you jump onto iTunes and leave a positive review for 12 Week Relationships, the podcast. That helps us to grow it. And if you're on YouTube, of course, the like, comment, all that kind of stuff helps us tremendously.
5 stars would be nice.
5 stars. 5 stars.
Yes.
That's it for us. We'll see you guys next time. Peace.